As a physical therapist, I've been getting asked a little bit more questions recently about getting into the field from either people who are interested, high school, undergrad, or PT students, kind of what to expect when you're getting into the field. So in this video, we're going to cover some of the questions that I've been asked. I would definitely say if you do have any additional questions, please feel free to reach out to either one of us. We are very passionate about helping people in the field and people who are interested in coming into the field. We are both physical therapists and both current residency mentors. We also completed an orthopedic residency. Steve has a little bit more experience managing teams and things like that, where I am like more along the clinician side of things, and also just like a general education online stuff, you guys know. So we'll go ahead and talk about our experiences, how we kind of came to where we are in our careers, and then answer some questions for you. All right, so just like briefly, we'll kind of talk about why we decided to get into physical therapy. So I guess you want to give a brief overview?
Sure. So I always knew I wanted to go in the healthcare field. I always wanted to work in an active setting. I started volunteering in a hospital nearby after school, and I was like, oh, this is cool. You can work in a gym, be able to work out all the time. That is false. You will not be able to work out all the time at your job, maybe after hours or whatnot, but that's kind of what I thought as a high schooler. Loved the kind of concept of building relationships with the patients and seeing them week in, week out, and watching them progress and just get back to what they were doing. Most people, I'd say, I feel like in PT, if you kind of pull the average person in school, they had an injury and they weren't in physical therapy themselves, but so I guess mine was a little bit different than that.
Yeah, and mine is also a little bit different than like the standard. I grew up doing gymnastics, and I was planning on doing engineering like both of my parents, and I took calculus and I said, I am never going to take a math again, so what else am I going to do? So I started researching different careers and things like that. I want to say like my mom like just was looking up stuff as well and gave me a list of things, and physical therapy I think was on that list, and I was like, yeah, that sounds interesting. I like how the human body moves. I find that interesting. And so I shadowed a PT, and I was like, yeah, I guess I can see myself doing this all day. I also thought it was going to be a little bit more of an active field. I liked the idea of it constantly changing and evolving, and you always continuously have to learn. So it's not like the same exact thing over and over again. There's some variability person to person, case to case, and then over time as well in the field. And just to keep you thinking, I guess I liked that as a career, and so that's kind of why I came into it. I actually never had physical therapy as well growing up, so that's kind of how I got into it. How long did it take you to get your degree? Because I know for both of us it's different than the standard.
Yeah, so I was actually in a program where I was auto-accepted from high school into grad school. So I finished undergrad in 3 years, got my bachelor's of science in biology, and then it was a 4-year program to get my doctorate. Since then, I don't think any of them do the 4 years for their doctorate anymore.
So it took you 7 years
So
total?
7, yeah, so
Okay.
7 total years to get the doctorate.
Yeah. And I did my undergraduate as well in 3 years. I just came in with AP credits from high school and was able to do that, and I was like, save money, yes, let's do it. And then it did take me the standard 3 years to get my doctorate of physical therapy. So that's kind of the track that I went, but I would say most people take 7 years to get there.
Four
So,
and 3.
yeah, 4 and 3. So what was your experience like in PT school, like classes, life, work-life balance, all of that kind of stuff?
Yeah, so for me, PT school was a little bit interesting because my first year of PT school was my senior year of college, and I went to the same university, so I definitely struggled with balancing academics with social life, I would say. I also was playing rugby and working, so from my standpoint, I definitely, pretty much my second year of PT school is when I actually kind of counted as, or almost counted like my first year of PT school in terms of prioritizing it a little better. I really wasn't probably to my third year that I actually got into a rhythm and was comfortable with what I was doing. So balance-wise, I would say I definitely was probably more skewed towards the social side of things, which is not the best thing, and definitely led to, I wouldn't even say more stress. Everyone was pretty much just as stressed, but more stressed than I needed. And there's a lot of proactive behaviors and understanding study habits that I didn't really get out of my first year or two that I should have, because I didn't really feel very challenged during undergrad, to be honest. I had to retake classes that I already tested out of with AP credits as well, just because it was my major. So I wasn't very stimulated there. So I didn't have a lot of study habits that I should have developed in undergrad. Probably also because I didn't take it seriously because of those reasons, and that put me behind the eight ball. But I definitely say from a stress level standpoint, everyone's pretty much very stressed out. And it's not really too much avoiding it altogether. It's just about minimizing it. And a lot of that has to do with how proactive you are in the beginning of the semester and trying to prevent having 5 things at once. Because your assignments will usually be where you have a lot of projects due about at the end of the semester, and that's when your finals are. So you shouldn't be working on those still at the end of the semester because you should be studying for your finals. And that's probably what I would say stands out the most from my experience.
Yeah. So you pretty much just like started projects when you first got them instead of waiting until like they were due, pretty much.
Eventually, yes. Yeah. Probably took me an extra 2 years to figure that one out. And I really was in a good rhythm, and there's a lot of people that were really freaking out and stressed out. And once I started doing that, I was not as stressed out, but it just took me a lot of time to kind of learn myself academically in terms of what was best for me, because I just didn't make academics enough of a priority for the first few years of college.
Gotcha. So my experience, I guess, though, taking this with a grain of salt, because giving a little bit of background information, I did gymnastics in undergrad, and so when I was transitioning into PT school, it was kind of like identity shift and probably not the best mental health and things like that. So I pretty much just dove right into studying, and it was very overwhelming. Despite pretty much studying every day, I was not the best note taker because I pretty much just transcribed every single lecture, which is not the best thing to do. And then I would just study the transcriptions of the lectures in addition to the PowerPoint slides, and it was just way too much. So I was very bad about choosing what was important and what was not important. And so I definitely suffered because of that, and it was just a lot. I also did not really study with a group. I pretty much studied by myself. I would also wait until last minute to study before exams, which is not the smartest thing. I don't know how I did it. I would pretty much start studying like the night before or a couple days before, and then really cram the morning up. So I was waking up, I remember waking up at like 11 p.m. studying through the night. So I would go to bed super early and then waking up super early, and it was just not the most sustainable thing. From like managing school and working out, you just kind of made it a priority. You did what you could. I would listen, so I'd record lectures and listen to them while running. It was absolutely miserable, but I did that.
A lot of people do that.
Yeah. And like I remember going on when like my parents were visiting or something like that, and I was studying, I would like print out all my notes. And I remember my dad quizzing me like when we were walking. On exam days, I would bike to class instead of driving because I was insanely tired and I didn't feel safe driving. And so, and also to get a workout in because I was not having time to work out otherwise. I know people would go to the gym in between classes and things like that. But I didn't really find that to be beneficial. I typically like would study during that time just because it was a lot of like back and forth. So it just like wasn't the most efficient use of my time, but really just make it happen. You can multitask while you're doing things, know that something's better than nothing, and do what you can, and know it's only a phase. It's only a couple years of your life, and you can get back into things as well. There are a lot of sacrifices that you make in PT school, definitely.
Yep.
What tips do you have for getting the most out of your clinical rotations? Because you've had PT students. I have not had PT students, but I've had residents, and I've kind of helped you out a little bit with students, but not a whole lot. So I'll let you.
Yeah, I'd say first and foremost, I mean, as a student, would be to know what your weaknesses are and ask questions. I think it's very easy to just not want to bother someone, but finding the right time to say, hey, you know, this is something I'd like to work on, or I'd like to work together on this patient, you know, different questions like that where you are upfront, not just in the moment asking these questions. So that way it's not just your, CI is busy, you don't know what they have going on their computer at all. Whether it's dealing with other staff members, helping with other clinics, and you and their caseload. They might have there's just a million different things that could be going on, even if it's whether it's a director or just a staff therapist. You don't know what's going on in their personal life that day until they tell you. But as we're on the front end of things, starting the day right after lunch, an hour, 2 hours before that patient comes in, having a plan, that's always helpful. Kind of going in to your weeks maybe and saying, hey, I'd like to work on this week, and communicating that to your CI is another experience. But really a lot of that ties into step one is choosing and being intentional with which experience you want, and maybe doing some research in advance, and I don't want to say interviewing, but questioning different places to see what would be the best fit for you. That's something that a lot of smarter PT students than I did during their times in PT school, and every one of them that took the time in advance to find the right place for them got exactly what they wanted. So, that's more of a proactive before, your internship strategy, and that actually is probably the most effective one and the one that's most overlooked.
Yeah. My experience as a PT student was more, I didn't know what questions to ask was my issue, and I wanted to ask questions, so it was just kind of like diving right in, absorbing everything that I could. I studied, I was always reviewing something on lunch. Like, I had CIs. My first CI was probably my best one, honestly, and that actually is part of the reason why I came to the company that I work for right now, was because it was with that company, and it was just very evidence-based. He gave me a packet of clinical prediction rules that I was able to study, provided me with resources, and still allowed me to treat the way I would want to treat. It just kind of was a very good environment to foster growth, and we would always review manual and things like that. So I definitely would recommend asking questions about what manual you want to practice, asking the why behind they chose a certain exercise, or they chose a certain manual technique, or things like that can be very helpful. If you don't know what question to ask, just be why'd you do that? I'm curious. This is what I was thinking. You probably did something better. So why did you do that? So I can learn. That's probably just a good question if you don't know what question to ask. And then just taking what you can out of each clinical rotation. Some of them might not be the best. You can always learn from that experience, even if it is just, what do I not want to do? So I had a couple that weren't necessarily the most helpful, but I got experience treating patients. I realized what type of environment I didn't like, and then so that's kind of what I would say. If you can research beforehand, I definitely would say to research beforehand. I didn't necessarily have the opportunity. It probably depends on what school you
can also reach out to classmates from the classes above you about their experiences at different spots.
Yeah, because the one rotation that I was most looking forward to is probably one of my least favorite ones, just based on
your experience.
Probably just the CI and my experience personally. But if you can research, in even just trying different settings too. I know your school will probably require different settings, but be open-minded, because you might find you like something that you didn't realize that you liked. Was PT kind of as you got into the field what you expected before you got into the field, whether it was before PT school or in PT school?
Yeah, I mean, other than not being able to work out while treating, I'd say that the physical treatment standpoint, 100%, I think that applies or has a lot to do with who you work with in terms of your autonomy. Does your manager and your boss let you kind of operate how you want to operate, but give you ideas as opposed to telling you what to do, and you feel like you get to maybe use some of your ideas? I think that has a lot to do with it. I think the main thing that stood out to me that was what I didn't expect is really how important the people that you work with are, and just manage low-level management in terms of your director and the person above them, and how much that kind of sets the tone and what you get to do. So, and then just the front office, their importance. Those were the things that I'd say those would be the things that I say I didn't really understand how important that was until, a few years later and you look back at it. But the physical treatment, yeah.
Yeah. I mean, I think the physical treatment was kind of what I expected when I was in PT school. I would probably say I also found like the emotional burden a little bit more than I thought it was going to be, because you are dealing with people who are in pain, have a lot of things going on, and then you have your own stuff on top of it, and you actually care about these people, so it's a lot emotionally, and then you also have the stress of like, am I really doing what I can? And like as a new grad, you're learning and growing and things like that. So the residency helped me a lot with that like emotional burden of things, so I can actually it made my decision making process a lot faster, and so I was able to take on a little bit more and not feel so overwhelmed. I think that was probably the thing that stood out to me the most of like, this is different than I expected. It was just more wearing, I guess, like emotionally than I thought it was going to be. Which I guess is kind of a good thing, because then it's like you actually care about the people. But it is a lot personally, I guess.
It's definitely very different, because a lot of people, your internships might be like 3 months or a few weeks, and then you're done. But when it's an actual career, that's not the case, and that's where that toll can kind of lead to people being burnt out, and that's where the mentoring and people that experienced that as well, and walking you through it, giving you strategies, encouraging whatever generic thing you want to say. It's not just a generic thing. It actually, you don't realize that it's helpful until there's a problem, and then you don't realize how helpful it is if there never is a problem. So it's tough to really understand the importance of that.
Definitely. And then what direction, I guess, did you choose to take with your career? I know you kind of hinted at it a little bit, but
Yeah, so I've had, I guess, a fair amount of directions that I've taken from a career standpoint. So, like I said, just kind of starts with day one or day negative, or negative day during your interview, right? Is asking questions that match what you want, right? So I wanted, more leadership positions to be available, and that really sets you up. Like, what are the answers you're getting, and then what are you actively doing to make sure that what you want is what's happening, right? So I'm at a point now where I'm a regional director. I oversee a handful of different clinics in East Atlanta, but at the same time I do a lot of mentoring, because I still wanted to be involved with that. A lot of just coaching and guiding and helping people out, and I still treat all full time, and that's very important to me as well. Is I don't want to stop treating right now, but I also realize the value and feel very fulfilled from helping make other clinicians be better and helping other leaders be more comfortable in their roles. Kind of the same as like the residency gave me that level of comfort once upon a time in my first year clinically, and now it's very fulfilling being able to make other people, whether they're directors or clinicians, being comfortable in that role. So I also serve as a residency mentor as well for that reason, because I find that fulfilling. So I guess I've gone a bunch of different directions in my career, but kind of all falling under the same umbrella. So whether it's, opening up brand new clinics and partnering, all the way down to just still literally being a normal clinician day in, day out. It's a pretty wide spectrum for just a single job I have.
And you're 5 to 6 years out now?
Yes.
Yeah, and then I'm 4 to 5-ish, somewhere in there. And so I am more of like that staff PT role, I guess, in the clinic. Going into it, I wasn't sure what route I wanted to go, so I wanted options. So the company that we work for offers the business side of things with partnering in clinics. It offers the leadership role, whether it's clinic director, regional director, and so on and so forth up the chain. You can go the educational route. We have a whole institute as part of the company, which does the residency and fellowship, and so you can teach as well if you wanted to do that. So I was like plenty of options. It'll give me time to decide what I want to do. And I actually ended up going a little bit with the residency mentoring, and I do really enjoy that. Still just standard staff PT, I really enjoy that as well. Just getting your hands on people, seeing people in person, it's just different. And then I also started my own business completely separate and do that using the education that I have, but in a completely different way. And also, so you have the business side of things, you have the training side of things, and it's just combining a ton of different passions there. And so it really depends on what you want out of the career. There's a ton of different things that you can do, a ton of different ways that you can go to really fulfill your why. And that's really going back to the burnout thing, I guess.
Nope.
Any recommendations for jobs before PT school or during PT school?
So I'll go back to when I was interviewing at first. What my bosses were looking for especially was people that had experience with teams. So that could have been sports.
I think that's more our boss specifically.
But it applies a lot. Whether it's sport, which isn't necessarily a job, but especially if you're a D1 athlete, it might as well be, all the way to just what job do you have where you were a teammate. For me specifically, I was a cook, which you would think has literally no carryover to PT whatsoever, but I can't express how much it's impacted my ability to do my job, whether it's just the customer service aspect, time management skills, having that internal clock when someone's about to be done with their exercise.
Managing a ton of different things at once.
Yep, managing a bunch of different things, having 3-4 tasks that you're juggling at a time, whether that's just emails and patient things like that. I was a tech as well, or PT tech, and that was very helpful to learn new exercises, understand different treatment styles, just have the umbrella view, or bird's eye view, so to speak, of the clinic that you're in. So tech is obviously the number one answer you're gonna get. That's helpful because it's the most related to the field. But I'd say that the most important things typically for your average PT is people that have experience being put in stressful situations, customer service, dealing with people in person, having difficult conversations with them. The PT background, like I said, obviously helpful because you are more familiar with the exercises and everything, but and being a member of a team. Leadership position, obviously, for anything is good, and that ties into just being a member of a team, though, as well.
Yeah, I think those answers are great. I would probably say PT tech. I feel like athletic trainers also sometimes have a little bit of a leg up, to some extent, depending on the person. There's just a little bit experience there. But if you're not really interested in that, then it depends. I can't really speak from personal experience, but I would say just a tech would probably be the best. So if you did find this helpful, let us know in the comments below. Please feel free to reach out. I personally have, and I know Steve has as well, hopped on calls with people who are interested in getting into the field, current students, people looking into trying to figure out what they want in a first job, et cetera, so forth. So honestly, feel free to reach out.